Yeah, so the migraine story is a little bit complicated. Like with the stroke story, PFOs are more common in people who have migraine. There's no question about that. PFO is even more common in people who have migraine with aura, and the aura refers to the neurological symptoms that can precede the headache part of a migraine. Typically, it's flashing lights. Some people get tingling in a hand. Some people get speech problems. So migraine with aura is related to PFO, and we think we kind of understand why it might happen. There have been a couple attempts at testing PFO closure as a treatment for migraine prevention. And the trials that did that in general didn't show that PFO closure was useful for migraine prevention. It doesn't mean that it might not still be in the right patients. And there are other studies going on now looking more carefully at a more select group of patients who really might benefit from PFO closure. And all of us who are in this business who see stroke patients who get their PFO closed know some of those stroke patients used to have migraines. And so many over the years, in my experience, have come back and said, once the PFO got closed, my migraines went away. I didn't tell them that. They just came back and said they just went away. Yeah. So for some people, it will probably be a useful therapy for migraine prevention. You don't want to do it if you get 2 migraines a year. It would be overkill, in my view. But if you get 2 headaches a week that are 2 days each, one day of which you're in a dark room vomiting and not doing what you're supposed to be doing, in those patients where the frequency is so high and the migraine disruption is so great, it might be worth considering something like PFO closure, but we're not there yet.
Okay.
And the other question was about
on the genetic, but just one the